I'm Chris from Affinity Home Care, and I'm lucky to have Dr. Anthony Lalama with us. For me, myself, we're working out at home, but Dr. Lalama is out as an essential physician working in the hospital, I believe, and your private practice.
Mm-hmm.
So
yeah, thanks for having me. I appreciate it. Definitely some difficult times right now, but yeah, we're open in the office and still doing some work in the hospitals as well.
Mm-hmm. Can you tell us a little bit more about your practice, the name, location?
Yeah, so we're Premier Foot and Ankle. We have 3 locations located in Macomb, Macomb Township, Michigan, West Bloomfield, Michigan, and Rochester Hills. We're podiatrists, so we are essential workers. Obviously, we take our work seriously, and we try to be as ethical as we can when it comes to this virus. So as far as patients we are seeing, I mean, both 3 of the partners in the group work at a wound care center, so that's essential care to keep them out of the emergency rooms. Then we have some patients here that are post-ops.
How is everything in your office? How are you guys handling the current situation with the COVID-19 coronavirus?
So, yeah, due to the virus, we've had to cut back. Again, it's more of an ethical. I mean, we could still see the array of podiatry patients as far as local diabetic foot care, but due to the virus, we've kind of taken the ethical stance and step back a little bit. And basically, we're just seeing any post-op patients that we've had that we did surgery on just prior to this virus and the shutdown. We also see anybody with an emergency, an acute ankle sprain, acute ankle fracture, or any wound care patient that we have as well. We've basically cut our office down to about 2 half days a week. Some of the staff right now is home, unfortunately, but our patient volume is definitely decreased.
So that was my next question. Are you accepting new patients right now?
So, yeah, we're taking new patients, patients that are willing to come in. We're willing to see whoever. We always tell our patients, if you stay out of the emergency room and out of the urgent care, especially at this point in time. So if there's, again, any acute injury, fell down a stair or slip and fall, whatever it may be, that you think you could have either broken something or sprained something, we are here to help. The question becomes on the patient side, are they okay with leaving the house and wanting to come in? So we can, make assessments other ways.
And telehealth, are you guys utilizing any type of telehealth communication with your patients?
So we do telehealth. Obviously, that's limited because our field, as you know, is more hands-on.
Yeah.
We try to do our best to give a mainstream type of diagnosis. If you did a post-op ingrown nail, or if somebody has an ingrown, that's something that we can do telehealth easily. If it is a follow-up from like a tendon injury or a plantar fascia injury, we can do that on telehealth too. But we're very hands-on as far as a specialty, so it makes it a little more difficult to do telehealth. But we do offer it.
Yeah, so if I have pain in my foot or something's going on with my toenail or what, you could still assess it over the telehealth and discuss the signs and the symptoms, and then they get to the point where you have to schedule an appointment.
Right, that's 100% correct. So,
yeah,
and if that is the case, we're here for them. So.
Yeah, and it's good. If you're sitting at home and you have to do a telehealth, but you're just not sure, you could just jump on the call right away.
Yeah, absolutely.
Yeah, which is a great asset to utilizing this technology. So can you get a good assessment over the phone or in a video chat, really, using telehealth?
A video chat obviously is better. I'm more visual than anything else, but if like I said, if it's a follow-up patient that has had a tendon injury that I've been treating for about a few weeks prior to this virus happening and causing it to shut down, I'm definitely able to kind of give them advice just over the phone. But if it's something new that has occurred, and I can go by a description and kind of go from that point. But the video is much better just because there's more of a visualization.
So what I know podiatrists, they do home visits too. So tell us a little bit about what's your activity now with the coronavirus and going to the homes? And I know that's a part of your feature of your practice that you guys will go.
So we can go to the homes, and we do have that. We currently are working. We have about 4 or 5 nursing retirement communities that we do care with. The biggest thing is when they want everybody to stop the spread of this, it's because we don't want to infect other people. With us being hospital, having hospital privileges and actually treating patients in the hospital now, we are electing to delay those patients unless it's something, again, that's urgent. Because I'm in the hospital, you know, it's a double-edged sword, because I go into the hospital, I may be okay, but I'm exposing myself while I'm in the hospital. I want to expose any other patients too, either. And that's the same thing when it comes to family. You know, we gotta, as you know, your care workers, if they're still going out, they got to go home to a family too. So there's a level of guilt. There's the guilt of, I don't want to bring it home to my family, but then there's that level of guilt where we care so much about our patients and we put so much work into treating these patients. We don't want to neglect the care that they deserve, but we're kind of in the middle here.
So when you go into someone's homes, what type of precautions, if you know, and protection are you utilizing right now?
So if it is, like I said, if it is something that's emergent, or, you know, excuse me, the diabetic foot wounds are the biggest thing for us. And our goal is to prevent these from getting infected. That makes the patient have to go into the ER or into a hospital that's full of COVID-19 patients. So the precautions we take, we have shoe covers, face masks, those N95s, which we're running low on, protective gowns that we wear, and gloves. Obviously, there's a sense of, you know, hand sanitizer, sanitizing instrumentation, all that kind of stuff. We're trying to cover any trail that we may leave behind or encounter with a patient that has it. But again, we've really decreased our home visits, more so for the patients.
You mentioned a diabetic ulcer, so obviously this is an emergency type of situation. I know I see that with our home care patients, where you know that's something that needs to be addressed right away. It could lead to, you know, what sometimes it could lead to amputation. You know,
can lead to amputation, abscess. Yeah, I mean, it depends on the severity. You know, if you have a chronic foot wound, it's typically there could be some things that are mismanaged or not controlled at that point, like their sugar level.
Yeah.
But patients with sugars about 250 or higher, there's about a 50% chance that they will get an infection, or a 50% chance it's harder for them to fight off an infection. So if we can go and provide local wound care and get all the microbiology, bugs, everything off of those wounds to help, you know, keep a clean environment, that'll help. You know, the diabetic wound care is a team effort. So it starts with primary care, podiatry, vascular or interventional cardiology, and then infectious disease, obviously. But yeah, right now everything's been under somewhat of control, so we're doing okay there.
Good, that's good. If you do surgery, can you follow up on a post-surgery through telehealth? How are you? If you know, I know that you mentioned to me that you go to the hospital still, and if you have a surgery, what's it looking like on your end as a post follow-up?
So right now, all elective surgeries have been postponed. Any elective procedure, not going to happen. But if there is an emergency, like a diabetic foot infection that requires a partial amputation, or somebody has an open ankle fracture, or somebody breaks their ankle, something that needs to be fixed immediately, we can still do that. And we can still see the post-operative patients. Our regular post-op protocol is probably not going to be the same. We'll try to extend it as far out as we can, but we still see the post-operative patients.
So thank you, Dr. Lalama. I really do appreciate, you know, your time. I know that not only being a doctor and a family man, but it sounds like also a community man too. You have developed a donation for a hospital to get more PPE in the home.
Yes.
The hospital. It's been strictly with hospital. Can you tell us about that?
Yeah, so we, you know, when you're involved with being in the hospital a lot, and you make a lot of relationships with a lot of physicians that are putting themselves. I always say, from a podiatry standpoint, we're in the trenches. We're not necessarily on the front lines, but you know, when you build a rapport and relationships with physicians that you've known for 10 years that are putting their life on the line every single day, and you're just kind of step back from the hospital because the volume is decreased for your particular specialty. My partner, Dr. Militello, and I just kind of thought, how could we help? You know, since we're not being there for our normal everyday occurrence. So we decided to start a fundraiser on a GoFundMe page. It's hashtag Stop the Spread. We're sending out wristbands as well, just to show your solidarity toward your physicians or friends or family that are doctors, that are on the front lines, or that are nurses, respiratory therapists, even home care agencies that are sending their, you know, their staff into these houses to continue proper care on these patients. So basically, we just donate to the GoFundMe page. Some of that money is going to go to the St. John Fund, which will help dispense more PPE equipment. It also helps with nurses and doctors and staff's families for food costs and everything else like that. So it's all on the GoFundMe page as far as where the monies will be going.
No, but it's part of like our duty, you and I, just to know this is important to keep safe and update with ourselves with all the precautions. And so we can go to your social media, Premier Foot and Ankle on Instagram. And
yeah, you go to Premier Foot and Ankle PLLC on Facebook and Premier Foot Ankle PLLC on Instagram. And the link's in the bio, or you could just go to the GoFundMe, hashtag Stop the Spread.
Great. Well, that's very honorable. Thank you for everything that you do. And, you know, we, again, we commend you for all your services that you provide, and hope you stay healthy.
Trying my best, Chris. Trying my best.